When the rains arrive, the landscape turns vibrant and green. It is the time of year when we are naturally drawn outdoors, visiting rural areas or letting children play in the tall grass. But this season also brings a predictable rise in illness. Clinics often see a surge of patients with sudden, high fevers, the kind of symptoms that usually point toward familiar threats like dengue or malaria. Sometimes, however, the tests for those common diseases come back negative. Despite the results, the fever stays high and the patient's condition doesn't improve. In many of these cases, the cause is an infection called Scrub Typhus. Understanding how this infection works is vital. It exists in the same grassy fields we visit every rainy season, but it often goes unnoticed because it mimics more common illnesses. The infection starts with a creature called a chigger mite. These mites are so small they are nearly invisible to the human eye, and they live deep within damp, tall grass. When you walk through the grass, a mite can latch onto your skin, transferring specific bacteria into your body. The painless bite causes no immediate redness, going entirely unnoticed. Once inside, the bacteria multiplies, spreading through your bloodstream while you feel perfectly normal. This is why the infection is so effective. It establishes itself within the body without triggering any of the early warning signs we usually rely on to tell us we're sick. When the symptoms finally arrive, they are intense. Within the first few days, a patient experiences a sudden high fever, a severe headache, and deep aching throughout the muscles. Because these signs look so much like a typical severe flu, it is easy for both patients and families to assume it's just a standard seasonal virus. As the days pass, the symptoms become more distinct. A persistent cough may develop, along with nausea and visible swelling in the lymph nodes around the neck or armpits. If the infection continues to spread, it can affect the brain. This often leads to moments of mental confusion or extreme dizziness, signaling that the body is struggling to cope. If we treat this like a normal flu and wait for it to pass on its own, we lose a window of time where the bacteria can be easily stopped before it causes internal damage. However, the mite bite often leaves behind a very specific signature. It is called an eschar, a small, dark, crusty black scab resembling a tiny cigarette burn with a red ring around the edge. Finding this painless black mark on the body is the most important sign for a doctor. It distinguishes this infection from the other common fevers of the season. Without the right treatment, the bacteria can cause the liver, kidneys, and brain to begin failing. To be certain, doctors use specialized blood tests designed to find the specific markers of this bacteria that standard seasonal tests usually miss. Once identified, the infection is highly treatable. A standard course of a specific antibiotic, like doxycycline, can stop the bacteria quickly. As this chart shows, once the medicine is started, a dangerously high fever typically drops back to normal within just 48 hours. While the risks are high if the infection is ignored, spotting that specific black scab changes everything. It allows a doctor to move from uncertainty to a fast and effective cure. Since there is no vaccine for scrub typhus, our best defense is changing how we interact with nature during the monsoon. When you are in rural or bushy areas, wear protective clothing. Long sleeves and long pants create a physical barrier that makes it much harder for mites to reach your skin. Using insect repellents on exposed skin is another simple way to keep microscopic mites away. Finally, make it a habit to check your skin after spending time in the grass. Look closely at yourself and your children for any new, dark scabs. We don't have to avoid the outdoors during the rainy season. By staying observant and acting quickly if a fever appears, we can stay safe and healthy all year round.